And as part of measures to contain the rising cases of cholera disease, the Lagos State government has warned the public against drinking untreated water while advising that food consumed should be prepared under proper hygiene. The state government also reveals that the results water samples collected in various parts of the state for laboratory analysis indicated that drinking water in some parts of the state is contaminated and not safe to drink. General Manager, the Lagos State Environmental Protection Agency, Dr. Babatunde Ajayi, said this while giving an update on the efforts made by his agency to contain a further spread of the disease. He said a team of experts from LASEPA ISO certified laboratory have been working with other relevant agencies like the Ministry of Health, Environment, Public Health Emergency Operations Center, NGOs and other bodies to bring the situation to normal. Dr. Ajayi disclosed further that the result of the laboratory analysis for the sampled waters in some areas visited include Udiolowo, Mushin, Kushofe and Lagos Island areas indicated that water is contaminated as they contained substance that made them not safe to drink. And for more on this, I'm being joined by the General Manager of LASEPA, Dr. Babatunde Ajayi. Good to have you on the news at 7 this evening. So first off, briefly give us more insights on the agency's findings of the water samples taken from some of the communities visited and what the agency is doing to address this concern.
Good evening, Esther, and thank you very much for having me on the news at 7. So LASEPA, being the EPA of Lagos, has gone around Lagos, particularly the clusters affected by the cholera outbreak, to sample water, potable water that people have been using to cook their food. We've seen all kinds of particulate matter, microbes and things in the water, and we have taken critical steps to make sure that we stem the rising infection of cholera across town. So first of all, with the ones we did at Lagos Island, we found that it was not safe for drinking. It had, coliforms, E. coli, and a couple of other microbes. And what we had done so far was in partnership with the Environmental Health Department of the Ministry of Health, sealed it up first, and then delivered water in tanks. Then we chlorinated it, and then over in the next couple of days, it will be safe for drinking, and we would be able to go back to it. Also, we're making sure that sanitation is improved. There are videos going around from one or two of the documentaries that we've shared on our social media platforms, where we have clearly shown that most of the water people sell, for residents in different areas, particularly those affected, are not done under hygienic conditions. And this water also is what people use to cook, the same water people use for production of fruit juices and all kinds of things that they sell to the public. So for those kinds of cases, we have also swung in. We have taken samples. We have released those results to the Ministry of Health. And as the Ministry of Environment, we are taking steps to make sure that they don't continue to infect people with their unhygienic practices. Also, we have raised advocacy around people who sell water and have them very close to their borehole pumps. So you should have at least 4 feet between your borehole pump and the sockaway pit. So for many of those people, it's just next to it, less than 2 feet. And clearly there will be seepage of feces and a few other things from the septic tanks into the water being pumped for sale. So we have addressed those kinds of things. We've closed them down. We are currently providing alternatives for those communities.
And
I think that's sort of some...
Yeah, and in providing alternatives, majority of us are used to sachet water. And from what you're finding state that even the conditions where the sachet water is being produced aren't healthy for consumption. What are your thoughts and what is being done to address this as well?
So for several of the water production companies, they're expected to, produce by certain standards. And for those ones, we have an agency that monitors it. It's the Water Regulatory Commission. They have also, heightened their inspection and monitoring around it. But as LASEPA, we have also taken samples of what they have coming into the environment from those water bodies. The ones that we have found unworthy, we have sealed them up. We have insisted that they meet up to the standards that have been set, And then we're making sure that, for those particular areas, we are doing advocacy. We're making them see that this water is not safe. You need to absolutely get a safer option, or you need to make sure that they do it in a more hygienic way. But as government, we are doing our bit. We're also insisting that they do the right thing, as stipulated in our regulations.
Right. Now, beyond just advocacy, there is this issue of open defecation, lack of potable water, which also remains a challenge in Lagos. Now, in the face of this rising cholera outbreak, what steps are being taken to ensure adequate provision of these facilities?
So for open defecation, it's a very big problem. I mean, it's a common thing around town. And what we have consistently done is to make sure that people use the available public toilets in certain areas. I mean, several of these areas where you have people doing open defecation, government has actually gone all the way to provide these alternatives. But some people do not really like to use them. I mean, primarily because they probably don't want to join a queue if there are so many of them living under the bridge, and people who don't want to do the right thing. They just don't want to follow the due process. So for us, we're insisting that they have to do the right thing. In addition to that, I know that the government is doing a lot of work. The Ministry of Environment is doing a lot of work to make sure that we build additional toilets. The organizations and corporate bodies like filling stations and all of those organizations that have additional accessible toilets to the public, we have also made sure that they are doing their bit in terms of making it accessible for public use. So for the open defecation, the ministry is doing a lot of work in making sure that there's more to be provided, and people have more access to proper toilets. As regards the potable water, I know that several efforts, a lot of effort has gone into provision of water, particularly for the affected communities. We have delivered water in tanks. We have delivered water in several forms to them. We have also insisted that the method of transporting that water to their homes should be properly and hygienically handled. We have also insisted that people who use these waters they are not comfortable with should purify them. They should boil them before being used. I mean, those are very simple, low-hanging methods that we can deploy to make sure that people have potable water. In addition to that, there's chlorination going on. We're distributing free chlorine tablets in the areas affected. And people just have to drop one chlorine tablet in 25 liters of water. It purifies it, and then it's safe for use. In addition to that, all of those that hawk water, all of those guys that push trucks and trolleys, to sell water, we have insisted that they clean their gallons. In one of the videos that we had shared earlier, you can see one of those gallons being opened. We actually cut it open in our laboratory, and we found that it was very badly maintained. It probably has not been cleaned in a year. And people who buy from them have not checked enough. So we are insisting that people begin to ask, you must ask, do you clean your gallons? And make sure that you also purify it and do your own bit as well.
All right, and well, that's where we have to leave this conversation. Thank you so much, General Manager of LASEPA, Dr. Babatunde Ajayi. We appreciate your time with us on the news at 7.